If anxiety has ever made your chest feel tight, heavy, or painful, you're not imagining it. That sensation can be intense enough to convince you something is seriously wrong. And the confusing part is that anxiety is just stress, yet your body reacts like there's a real physical threat. The key idea is simple. Anxiety turns on survival biology. Your nervous system shifts into fight or flight, and the chest is one of the first places you notice it. Muscles tense, breathing changes, heart sensations become louder, and your brain starts scanning for danger, which makes every twinge feel bigger. In this presentation, you'll get a clear, practical map of what causes chest discomfort during anxiety, why it can mimic heart problems, and what patterns tend to amplify it. You'll also learn the red flags that deserve medical attention, because reassurance should be based on facts, not guesses. Let's break down what's happening, step by step, in plain language. Moving to slide 2. Start with the core switch, your autonomic nervous system. It has two main modes, rest and digest, and fight or flight. When your brain detects threat, even an internal threat like a scary thought, it releases stress hormones like adrenaline. That changes your heart rate, blood flow, and muscle readiness within seconds. Blood is redirected toward large muscles, and smaller muscles, including those around the chest wall, can tighten. Your breathing often becomes faster and shallower because your body is preparing for action. None of this requires a real external danger. The alarm system is built to react to uncertainty, not just certainty. And once the alarm is on, your brain becomes more sensitive to body signals, especially in the chest, because the chest is linked to breathing and heartbeat. Two things your brain treats as must monitor. So the discomfort is real. It's produced by normal physiology under stress, not by imagination. Moving to slide 3. One major contributor is muscle tension. Anxiety often makes you brace without noticing. Your shoulders lift, your neck tightens, your chest wall muscles, including the intercostals between your ribs, can stay partially contracted. Over minutes or hours, that can create soreness, pressure, or a sharp stitch feeling when you move or breathe deeply. Some people also clench their jaw, which can spread tension down the neck into the upper chest. This is why chest discomfort during anxiety can feel worse after a long day of stress, even if nothing happened physically. It's similar to how you might get a tension headache. Muscles plus sustained arousal equals pain. Another clue is that muscle-based discomfort often changes with posture, stretching, pressing on the area, or turning your torso. It can still be scary, but it has a mechanical component that anxiety can trigger and maintain. Moving to slide 4. Breathing changes are another big piece, especially hyperventilation. Hyperventilation doesn't always look like obvious panting. It can be subtle, slightly faster breaths, more upper chest breathing, less belly movement. When you breathe off too much carbon dioxide, blood chemistry shifts. That can cause tingling, lightheadedness, and a tight or constricted chest feeling. It can also trigger spasms in small muscles, including those involved in breathing. Many people interpret this as I can't get enough air, but often it's the opposite. You're getting plenty of oxygen, but the carbon dioxide level is dropping. Anxiety also makes you sigh, yawn, or take repeated deep breaths to fix the feeling. Ironically, that can keep the cycle going. Once breathing feels effortful, your brain flags it as danger, and the chest sensations become even more attention-grabbing. Moving to slide 5. Now let's talk about the heart sensations themselves. During anxiety, adrenaline can make your heart beat faster, harder, or more irregular feeling. You might notice palpitations, skipped beats, or a pounding sensation in your chest or throat. For many people, these are benign rhythm changes that happen in healthy hearts too, but they feel dramatic when you're already on high alert. Anxiety also increases interoception, which is your awareness of internal signals. It's like turning up the volume on your heartbeat. A normal beat can feel like a thump. A normal variation can feel like a warning. And once you notice it, you start checking, which keeps your attention locked onto the chest. That attention loop is powerful. The more you monitor, the more sensations you detect, and the more real and urgent they feel, even when the underlying change is just a normal stress response. Moving to slide 6. Another cause is the stress response in your digestive system, which can masquerade as chest pain. Anxiety can increase stomach acid, slow digestion, and create gas or pressure. Reflux, where acid irritates the esophagus, can cause burning behind the breastbone, tightness, or a lump in throat sensation. Because the esophagus runs through the chest, the brain can misread that discomfort as heart-related. Stress can also make you swallow more air, especially if you're breathing fast or talking quickly. That air can create bloating and pressure that radiates upward. The tricky part is that reflux discomfort can spike during anxious moments, which makes it feel caused by the heart, even though it's coming from the gut. If your chest discomfort is related to meals, lying down, or a sour taste, that pattern can be a useful clue to discuss with a clinician. Moving to slide 7. So why does it feel so real and so urgent? Because your brain is doing threat prediction. When you're anxious, the brain's salience network prioritizes signals that could mean danger. Chest sensations rank high because they relate to breathing and circulation. Then comes catastrophic interpretation, where the mind jumps from sensation to worst-case story: heart attack, collapse, losing control. That story increases adrenaline, which increases sensations, which confirms the story. It's a feedback loop. Studies on panic and anxiety show that interpretation matters as much as the sensation itself. Two people can feel the same flutter. One shrugs it off. The other spirals because their brain labels it as unsafe. The goal isn't to blame yourself. It's to understand the mechanism. When you can name the loop, sensation, interpretation, adrenaline, more sensation, you can start interrupting it. Moving to slide 8. There's also a phenomenon called sensitization. After a few scary episodes, your nervous system learns that certain sensations predict panic. So the next time you feel a mild tightness, your body reacts faster, like a smoke alarm set to a hair trigger. This is why chest discomfort can start happening in specific places: driving, grocery stores, bedtime, meetings, where you previously felt trapped or overwhelmed. Your brain links context plus sensation and prepares for danger before you consciously decide anything. That learned association can make symptoms feel random, but they're often patterned. Another part is avoidance. If you start avoiding exercise, stairs, or anything that raises your heart rate, your body becomes less familiar with normal exertion sensations. Then, a normal increase in heart rate feels unfamiliar and threatening. Sensitization plus avoidance can keep the cycle going, even when life is relatively calm. Moving to slide 9. Let's separate anxiety chest discomfort from signs that need urgent evaluation. Anxiety can cause intense symptoms, but it's still important to respect the possibility of medical causes. Red flags include chest pressure that is new, severe, or crushing, especially if it spreads to the arm, jaw, or back. Also watch for fainting, severe shortness of breath at rest, coughing up blood, or symptoms that come with weakness on one side or trouble speaking. If you have known heart disease risk factors, like diabetes or prior heart problems, take new chest symptoms seriously. The point here is not to scare you, it's to give you a clear boundary. Many people with anxiety delay getting checked because they feel embarrassed, and that can increase fear. A medical evaluation can rule out dangerous causes and make it easier to treat the anxiety cycle with confidence and clarity. Moving to slide 10. If you've been medically cleared, the next step is learning what helps de-escalate the body. One helpful approach is to shift from checking to observing. Instead of scanning your chest for danger, label sensations in neutral terms: tight, warm, sharp, moving, steady. That reduces catastrophic interpretation. Breathing can also be adjusted gently. The goal is not huge, deep breaths, but slower, steadier breathing that lowers arousal and stabilizes carbon dioxide. Relaxing the chest wall helps too, dropping the shoulders, unclenching the jaw, and letting the belly soften. Another strategy is to allow the heart rate to be present without fighting it. Fighting signals danger to the brain, allowing signals safety. This isn't about forcing calm. It's about sending your nervous system consistent cues that the sensation is uncomfortable, but not automatically an emergency. Moving to slide 11. Longer term, the most effective changes usually target two things: baseline stress and fear of sensations. Baseline stress includes sleep quality, caffeine sensitivity, workload, and ongoing conflict. When your nervous system is already taxed, it reacts harder to small triggers. Fear of sensations is addressed through skills that retrain your interpretation. Many evidence-based therapies for panic and health anxiety focus on learning that sensations can rise and fall without catastrophe. Some people benefit from interoceptive exposure, which means safely practicing sensations like increased heart rate or breathlessness in a controlled way, so the brain relearns them as non-threatening. This is often done with professional guidance. The big idea is that confidence comes from repeated safe experiences, not from perfect control. You're teaching your brain through repetition that chest sensations can be intense and still pass. Moving to slide 12. A quick word on tracking and reassurance. It's tempting to constantly Google symptoms, check your pulse, or use devices to confirm you're okay. Sometimes short-term reassurance helps, but repeated checking can train your brain to treat uncertainty as intolerable. Then the chest sensation becomes the trigger to check, and checking becomes the ritual that keeps anxiety alive. A more balanced approach is planned reassurance. For example, you might decide what symptoms warrant medical care, and otherwise practice riding out the wave. If you do use a wearable, use it as a data tool, not a safety crutch. And remember that anxiety can create real physical discomfort without causing damage. The goal is to respond proportionally. Take red flags seriously, but don't let every normal fluctuation become an emergency. That middle path is where recovery tends to live. Moving to slide 13. Let's tie it all together. Chest discomfort during anxiety usually comes from a mix of muscle tension, breathing chemistry, heart sensation amplification, and sometimes digestive irritation. It feels so real because it is real. Your body is in a high alert state, and your brain is interpreting chest signals as urgent. The good news is that once you understand the mechanisms, you can spot patterns, reduce the feedback loop, and respond with skills instead of panic. If you've had chest symptoms and you're unsure, getting medically evaluated is a reasonable step, especially with red flags or risk factors. If you found this breakdown helpful, subscribe for more clear explanations of how the body and mind interact under stress. And I'm curious, when anxiety hits, do you feel it more as chest tightness or as heart palpitations? Share your experience in the comments. This information is not a substitute for medical advice.